Come in.
Hi, my name is Jacob. I'm the nurse going to give you your discharge.
Hi.
Do you have a moment to talk?
Yes.
All right. All right, so I've got your discharge folder here. We've got all your instructions and everything to take care of yourself at home. Before we continue, can you confirm your name and date of birth with me?
Shanti Lato 10/9/82.
Perfect. All right, you're just the Shanti I'm looking for. All right, so the providers looked through all your test results and your imaging results. They feel that you're safe to go home. Did they come and discuss your test results with you already?
Yeah. I'm not being hospitalized?
Correct. So based on the vital signs, the findings from your lab results, and the imaging results, the provider feels it's safe to go home and continue your treatment there.
Okay.
So according to your chart, the reason that you came in today was for having a cough for several days, as well as that congestion you're having and generally feeling unwell. Does that sound correct?
Yes, it was getting worse, no matter what I did, so I decided to come to the emergency room.
And I'm glad you came to see us. So the provider did complete a medical examination and listen to your lungs. You also had blood work done as well as a chest x-ray performed. Does that all sound complete to you?
Yes, they did an x-ray. What did they find again on the x-ray?
So the x-ray showed a spot of pneumonia in your left lower lung.
Okay.
And then the blood work did show some test results that we would expect with an infection, like an elevated white blood cell.
Is that abnormal?
It's normal when you have an infection. It's your body's response to the infection and proves to us that you're fighting something.
Okay.
So the diagnosis today is pneumonia.
Okay, is that serious?
If left untreated, it can be, but the good news is right now your vital signs are stable, and if we get these antibiotics and steroids started early, you should start feeling better in the next few days. So the first prescription we've got here is Augmentin, which is an antibiotic. You're going to take that twice daily, and I would say it's important to take that one with food to avoid any nausea or upset stomach. And then the second medication is prednisone. That's a steroid. You're going to take that once a day, and I always recommend taking it early in the morning rather than later in the day, because after you take it, sometimes it'll give you a lot of energy, which can make it really hard to sleep at night.
Okay.
And then both prescriptions are being sent to the CVS here in Apopka on Main Street. Does that sound correct?
Yes, it sounds correct. Quick question about the prednisone. What's that one for again?
So that is a steroid, and what it'll do is it'll actually help reduce the inflammation inside your lungs, and it should help decrease the cough and make it a little bit easier to breathe and help your body fight this infection.
Okay.
And the provider put here that they'd like you to follow up with your primary care provider in the next few days. Do you have a PCP that you normally see?
I have a family care physician, yes.
Perfect. I would recommend calling them today if you can. If not, then no later than tomorrow to try and get seen in the next 3 to 5 days.
Okay.
That way they can follow up with you. They can take another listen to your lungs and just make sure overall that the treatment's working and you're starting to feel better.
All right.
Now, while we're confident these medications are the right medications and they should help you start feeling better, please know you can always come back and see us. I know it's probably not what you want to do, but if you start feeling worse, worsening chest pain, shortness of breath, confusion, fever that won't go away, or any of the symptoms you're having are getting worse over the next few days instead of better, we want you to come back and see us so we can take another look.
All right.
So we've gone over a lot of information. What questions do you have for me right now?
When can I go back to work?
With a fever, we would recommend being at least fever-free for 24 hours before you go back to work. Would it help to get a work note from our provider
Yes.
to excuse for the next few days?
Yes.
Perfect. How does 3 days sound?
Oh, that would be great.
Okay, perfect. I'll ask the provider if they can go ahead and put that in. And then, of course, if you see your primary care doctor, they may extend that longer if they feel like it's necessary.
Okay.
Okay, so we've gone over a lot. Can you tell me what we're sending you home for and what your follow-up plan is?
Okay, so I have pneumonia in the left side of my lung. I'm going with, I don't remember the name, but it's antibiotic.
Yes.
And a steroid to help me breathe better.
Perfect.
And then I can't work for another 2 to 3 days.
Very good.
As long as I have a fever.
Yes.
And then I have to follow up with my primary care physician.
Yes, absolutely. And the antibiotic is Augmentin.
Okay, yes.
All right, so here's your discharge instructions. Your prescription is being sent electronically directly to CVS. I wrote my name here. My name is Jacob. It was a pleasure to take care of you today. Your provider here in the ER was Dr. Trevina. And I just want to highlight on the back, there is a lot of phone numbers here. If you would have any questions about your visit, this number here gets you directly to us here in the ER. And then there's other things here about follow-up imaging, scheduling, or needing to schedule appointments right there.
Oh, perfect.
Any other questions for me before you get out of here?
Can you write the name of the tech? He was really good.
Absolutely.
I remember him too.
Funny enough, his name was also Jacob, but I'll write that here for you. And then I'm going to go ahead and step out so you can get changed. Is there any other questions that you have for me?
No, I'm good. Thank
Okay.
you.
And then once you're done getting changed, I'll be right outside your door finishing up some documentation. If you want to either open the door or hit your call out, I'll be happy to help you get out of here.
Thank you.
All right.
I
Well, it was a pleasure
appreciate it.
taking care of you today. I hope you get feeling better.
Thank you. You guys were great.
Thank you.